I'd like you to, your surgery's in your country practice, and your next patient is Jane.
Hi.
Hi, Jane.
How are you?
I'm Dr. Kavanagh. I don't think we've met before.
No, we haven't, no. I haven't been living here that long yet, so.
What can I do for you today, Jane?
Well, I brought my son in, Jane, because he needed his vaccines. I just thought while I'm here, I would mention that for the last couple of months, my period seems to be getting a bit heavier. It's sort of happening in between.
Right. And perhaps a few details about you.
Okay, sure. What would you like to know?
Well, how old are you?
38.
Right. And you have one child? Do you have
No,
other?
I've got two boys.
You've got two
yeah.
boys.
Trying for another one, but yeah, two at the moment.
Right, okay. And how old were you when your period started?
14.
Right, and how have they been?
Pretty regular, sort of normal, 4 or 5 days, every 28 days.
Right. And so it's a couple of months that you've been bleeding more heavily?
Yeah, I sort of noticed the last 3 or 4 months. Like it was just a little bit first, but it seemed to be getting heavier. Like they were kind of heavier and longer, but then I was getting a bit of bleeding in between. And then the last few times my husband and I have had sex because we're trying to get pregnant again. It's happened after that.
Right. When was your last pap smear, Jane?
About 10, 11 months ago.
Right. And how was that?
Yeah, it was all good, all clear.
And have you always had normal pap smears?
Yep, always had normal ones.
Right. Okay. And so you've been off the pill for?
Yeah, I didn't go back on it after I had the last one, so.
Right.
Like quite a while now.
Right. Okay. Perhaps we need to look into this bleeding a little more.
Okay.
Would you be happy if I examined you?
Yeah.
And perhaps we need even to take another pap smear, even though your last one was normal.
Yep, sure.
Yeah. Okay. And then we'll wait for the outcome of that smear. But I think even if the smear was negative, you probably would need perhaps to see a gynaecologist about the fact that you've got this abnormal bleeding.
Yeah. So is it a number of different things, or?
Yes, I guess it could be what's called dysfunctional uterine bleeding, which is just bleeding that doesn't follow the normal pattern.
Yeah.
And I guess the other end of the spectrum is it could be perhaps due to a cancer of some sort.
Okay.
So we need to exclude the serious reasons before.
Well, I'd say being that my last pap smear was fine, that should be okay. But I just thought I'd check while I'm here.
I think you're very wise to check. Yes. Yeah.
Yeah, because I don't know if it's sort of getting in the way of us trying to conceive again. So.
And I guess you really need to sort it out before you become pregnant, if possible.
Yeah, that's what I just noticed, because I was sitting between, trying for the last couple of months, and it just the last few times, and I thought, well, that's a bit unusual.
So when was your last actual period?
2 weeks ago, I think.
Right.
Yeah.
And was that at a normal interval?
No, well, I'd had like a few, like it was longer. And so like I didn't sort of have as long a break in between periods, and then I'd had a few days where I'd had extra bleeding, sort of right smack bang in the middle.
Right.
And then since it finished, 2 weeks ago, I've had quite a few days where I've had bleeding as well.
Right. One of the things we probably do need to establish is whether or not you're actually pregnant at the moment.
Okay. Well, that'd be good.
We could do that with a pregnancy test.
Yeah.
Yeah. Do you know about your mother's menstrual cycle?
Fairly similar to mine, I think, although I don't remember ever mentioning bleeding in between.
Right. Do you know what age she reached menopause?
Not much older than what I am now, really.
Right.
Yeah.
So she had quite an early menopause.
Yeah, early 40s, I think.
Yeah. So one of the other things that we might consider in investigating this bleeding is could you be approaching menopause somewhat prematurely?
Can you delay it, because we really want a girl?
I think it would be difficult to delay menopause. We don't have the technology or the.
Oh, I know. My husband and I are just desperate to have a girl. We've got 2 boys, and we just kind of want to balance it out a bit.
Thank you very much indeed. Thank you.
Okay.